brief overview of what I do every day as a dental assistant. I start in the morning, coming about 30 to 45 minutes ahead of time before my patients get here. I'll arrive at the building and immediately put on my computer. Then I'll go into my sterilization room and get ready with instruments and unloading the autoclave and getting my laboratory ready in order to clean my instruments and sterilize them properly for the day in between patients. Then I have to get ready for my patients, which is reviewing their x-rays and notes and medical history and the procedures that I'm going to do for the day so that I can prepare the instruments properly and be prepared for the procedure properly. I'll see several patients throughout the day, depending on how many is different every day, and the amount of time that I do is different also. Today I will be seeing a few patients, some in a lengthy manner, some in a short manner. By the time I'm done, I will have sterilized the room, prepared the room, sterilized it again, and get ready for the next patient so that I can assist the doctor in the procedure that he's doing on the patient. The end of the day, I will have to clean up and make sure I'm ready for the next day, which means stocking the room with all the supplies I will need, whether that's cotton or mask or gloves. And then that will wind up with me cleaning the instruments and putting them in the autoclave and turning those machines on so that everything's ready to go tomorrow. This is my sterilization area. I have to get ready each morning by putting new water and disinfectant in the ultrasonic. I have the autoclave that I have to pull out all the instruments that were cooked from the night before and put them on trays so that I can put them back into the operatories ready for my patients for the day. I've gotten ready for my patients now. I've restocked my room with my instruments and my trays and my supplies, and so now I've got to get the room ready for my first patient. All right, I have my room ready, my operatory ready for my first patient, which I'm going to go and get her now, but I'm first going to bring up the x-rays that the doctor will need in order to review before he gets going with the procedure. Okay, if you want to put your purse up here. I've walked my patient out. I've written down exactly what the doctor and I did today so that the front desk knows. Now it's time to clean up my room. But my most important role was assisting the doctor so that the procedure went quick, it went fast. I handed instruments that were laid over here. I kept the patient comfortable. We spoke with her throughout the process, making sure she stayed comfortable and was not in pain. I assisted the doctor so that the procedure went smooth, went quite quickly, and the patient was able to get on her way with a comfortable experience. Now it's time to clean my room and get ready for my next patient. All right, I've put up the dirty instruments into the laboratory, the sterilization area, so that those can be cleaned in just a second. It's important that I keep moving and keep things going, so now while those are in there, I'm going to wipe down my room and get ready for my next patient, and then go back in there in order to clean the instruments and get them ready. Now it's time to go ahead and disinfect and sterilize and shake the instruments so that they can be properly cleaned and then sterilized in the autoclave. I'm going to break down this tray and put my instruments in the ultrasonic and dispose of the trash in its proper sharps container, or if it needs to be thrown away, I throw it away. I need to use my utility gloves. I need to have my mask on and my protective glasses. All right, it's time to move on to the next patient, which is taking impressions. She will be here shortly. The front desk will let me know when she's here, but in the meantime, I'm gonna get ready for her and set up my room appropriately with the things I would need in order to take the impressions that the doctor will request. But the first thing I want to ask you is how's that pain on that one tooth? Have you figured out if it's
I haven't
a
figured
tooth?
it out.
Okay.
I have not figured it out which tooth.
Okay. Okay, I know you've been through this before.
Yes.
I'm gonna try this in first and make sure it fits before I put the goop in. Okay. And what's scary is I remember and stay open. Let's see if I can go down to the blue real fast. Yep, I'm gonna use that blue one. Take that pressure. Okay. I need to stay open slightly.